Hey guys, this is Dr. Jason Tirado, your West New York chiropractor, and today's Whiplash alert, we are talking about how long-term results for neck injuries can be good and they can also be bad. You know, with any type of neck injury, such as, let's say, a pulled muscle or maybe, that knot or that kink inside the neck, it's usually something that we've all experienced. And it's like these little aches and pains, they usually go away on their own. Because they may not be big, right? With like a little massage or maybe a little bit of rubbing or maybe just kind of pushing on the area and kind of stretching it out. But sometimes neck injuries can be more substantial, and that's when you probably need to go to a chiropractor. And a neck injury could be something like a whiplash accident from maybe a car accident, or possibly even whiplash that you might get in a sports injury like a football accident. And typically in these cases, the ligaments inside the neck can be injured, and the nerves inside the neck can begin to get injured, and they can get inflamed and they can get irritated as well. Mostly the long-term course for neck pain, it's never really good. Sometimes it might even require surgery, and patients typically continue to suffer years later with neck pain. But there was one study that actually looked at the outcomes after about 5 years and found that about 50% of patients with neck pain continued to have pain and even disability. The problem is that when the ligaments and the muscles inside the neck become injured, the patient begins to guard inside their neck muscles. Guarding meaning they kind of tighten up and they guard their movements, and then they don't use other muscles inside the neck. And that can lead to muscles becoming atrophied, or they can become weak over the long term. And as those neck muscles start to go, then so does the rest of the spine, the muscles of the rest of the spine. Or at least that's what the research is actually starting to show. Typically following some type of traumatic injury to the neck, it's really important to get a proper examination and also get x-rays, sometimes even CT scans and sometimes MRIs. And getting an accurate diagnosis of the neck injury, well, that's always going to be your first step to getting you the treatment that you need and the care that you need. So that's most important. One study actually showed that early intervention within probably the first week of an injury, in a whiplash injury, typically gave patients a lot more relief when compared to, let's say, delayed treatment, like maybe 2 weeks or maybe even 21 days later. As discussed, a lot of patients many patients become chronic, and they actually have long-term pain inside their neck after neck injuries. And a lot of others begin to develop secondary types of problems, such as maybe lower back pain or possibly even sciatica, that's pain that radiates into the legs, literally 1 to maybe even 2 years down the road. And because of these long-term effects, it's really important to treat these neck injuries very, very serious. Don't just leave them alone. They really, really need to be treated seriously. You cannot just let it go. And which means that, just putting a bag of ice on your neck, it's not going to be sufficient. Or maybe putting a little bit of icy hot on your neck, well, that's not going to be efficient either. These are mechanical types of problems, and it's the mechanical types of problems that are not typically correctable through icy hot or ice on the neck or putting on a neck collar, or maybe even taking anti-inflammatories or cortisone injections or medication. It's really specific chiropractic care following some type of neck injury or a sprain. It actually will begin to move the joints inside the neck into better alignment with the other bones, and it begins to ease the tension that are on these muscles and the soft tissues inside the neck. It's the limited range of motion inside the neck that, if you don't take care of, can actually turn into bigger problems. So that's about it. This is Dr. Jason Tirado. Thanks for listening. I'll see you soon.